Hi, and welcome to this episode of Detroit Peds Talk. I'm Dr. Jameel Smith, lead integrated behavioral health pediatric psychologist at Wayne Pediatrics. Today I'm here with Dr. Chris Youngman. He's our chief medical officer and general pediatrician at Wayne Pediatrics and assistant professor of pediatrics at Wayne State University in the School of Medicine. He's here to discuss the importance of integrated behavioral health, how behavior issues can arise in our children, and how Wayne Pediatrics can help. Thank you for joining me today, Dr. Youngman.
Thank you for having me.
So, what is integrated behavioral health? Integrated behavioral health care blends care in one setting for medical conditions and related behavioral health concerns that affect health and well-being. And integrated behavioral health also considers medical and social factors that can lead to mental health issues like substance use, habits, and life circumstances. These life circumstances, which can affect behavioral health, can sometimes include poverty or lack of support network, access to health care, and even our physical environment. So, Dr. Youngman, what are some factors you see your patients experiencing that might affect their behavioral health?
Absolutely. We do see behavioral health integrated into our patients' lives right from the very start. So we specialize in caring for children through their growth and development phases all the way into early adulthood. We know that the brain doesn't typically fully mature until ages 24 to 26. So there's many different components. The body goes through significant changes. There's hormonal influences that can impact their development as well. And then external stressors. So the first 5 years of life are very important in terms of the foundation of brain and development. And during that time period, the brain is susceptible to different things occurring that can have long-term impact on children. So we do see the importance of behavioral health and how it affects children's lives at many different phases. One of the most common times where we see mental health issues start to arise is in adolescence, but it can occur even earlier than that. And so having routine appointments and times to check in with the physician is extremely important, because one child's behavior may be different than another child's behavior. And the advantage of seeing a pediatrician is you get to the experience that physician has had working with many different children, and kind of the spectrum of what's normal and what may be abnormal. And so talking through those things is important.
Right.
During times of puberty, there's a lot of hormonal changes that occur. So that can have a significant influence. But also we know that our patients in today's society have other pressures on them that they didn't have before. One of those is social media. So we know that 97% of children are reported to be on social media at some point during their developmental years. And that is another area in which they may experience bullying or online pressures that some of us as adults may not have experienced.
Yeah. And I like how you mentioned, as pediatricians, you really are interested in just the development of children. And we know that as children age, they experience a lot of things, challenges with siblings, attention, concentration difficulties, and, difficulty making friends. And that ends up coming up in the visit, when you're working with your patients. Why do you think behavioral health integration is important for your patients?
Because we see that has a significant impact on their growth and development. We also know that children that have chronic diseases are going to be more prone to problems with behavioral health issues and mental health issues, because they will feel that they are different than their peers. And particularly that adolescent age where they are starting to look more to their peer group and compare themselves to their peers, any sort of difference gets magnified significantly. And that can impact how they take care of themselves, and how they take care of themselves during those years can have effects on their health later on in life. So we definitely want to be cognizant of those stressors that they're undergoing, and check in with them and help them with resources that are going to optimize their childhood so that they can lead healthy adult lives.
Yeah, yeah. We know, like with diabetes, for example, that really does affect and change and impact, for example, a teenager's whole world, and, naturally how they interact with others, how they see themselves, comes up within that visit with their physician. What are some of the, somatic symptoms or physical complaints you see sometimes stemming from mental health issues with young people?
Absolutely. So we can see children with depression lose interest, have more symptoms of fatigue, being tired, sleeping more, dropping grades, and then complain of headaches or stomach aches, other ailments that may not be as localized or caused by something specific, but more generalized. We've seen patients with anxiety have symptoms of shortness of breath, difficulty breathing, can mimic other medical conditions like asthma attacks. They can also have chest pains, which can be very alarming. So these are some of the symptoms that we sometimes see in patients that have behavioral health conditions.
Yeah. And so, for our audience, when a young person presents with some of these complaints, and as a physician, you're trying to figure out, what's going on, could you explain to our audience, how is behavioral health integrated here at Wayne Pediatrics?
Absolutely. So behavioral health, we integrate in multiple ways. We often do screening questionnaires, and these start as early as the first visit as a follow-up from the hospital, where we screen the moms for postpartum depression. We know that postpartum depression is a very serious condition that can affect the child's growth and development significantly. So we screen for it because we know that many times those new mothers aren't going to see their own physician until about 6 to 8 weeks after delivery. So it's a time period where we may see symptoms that need to be addressed before they have that first follow-up with their physician. But beyond that, we also are doing developmental screenings, and then other screenings that we screen for anxiety and depression, and then behaviors that are risk-taking in the adolescent time period too. So these are very important areas that if we identify early, that we can hopefully connect families with resources and interventions. So in our clinic, we're fortunate enough to have a case management worker that can work with families to help link them up with appropriate resources. We also have an amazing psychologist that meets with many of our families and helps with these issues.
Yeah. What are the kinds of things might parents or even young people expect during that doctor's appointment to support integrated behavioral health? What kind of supports or interactions might they expect?
Yeah, absolutely. So they may, one, be asked to fill out some screening questionnaires. They may also have a member of the team from the integrated behavioral health team join into part of the visits or meet with the families and touch base with them. And then they may get a visit from you yourself and talk about either interventions and then possibly whether or not more evaluation is needed or referrals into the community.
Yeah. Well, thank you, Dr. Youngman, for sharing the value of integrated behavioral health at Wayne Pediatrics and explaining to our audience what kind of support families can expect. Just this week, the American Psychological Association highlighted trends in psychology, that we need to move away from just this one-to-one therapy approach all the time and really strengthen health across the entire population. And integrated behavioral health is one way we can achieve this. So if you have a child, it's important to remember their mental health is just as important as their physical health. And Wayne Pediatrics Integrated Behavioral Health Program is a great way to ensure your child has the skills that they need to cope with life and treat mental health issues in a holistic way. For more information about Wayne Pediatrics, please visit waynepediatrics.org. Also follow us on Instagram and Facebook for new shows posting monthly every first Wednesday. And remember, pediatricians are the best option for the medical needs of children. Take care.